Another study that we did, building upon the question of long-term outcomes for kids with single ventricle heart disease or congenital heart disease really in general. As I said, we've made a lot of progress in treating these kids, doing surgery, doing other medicines, yet what happens to them when they leave the hospital? Okay? And so a big area of concern for them is what happens with their neurodevelopment, specifically how does their brain form? Many of these kids we find out are born with brain problems, even prenatally. Many we know may have problems with their brain due to just some of the surgical procedures that we do in a time of hypoxia for the brain. But are they at higher risk of having poor neurodevelopmental outcomes? And so while many in the past have looked at just some neurodevelopmental psychological testing in kids, we decided to look at what happens when they're actually in school and taking their standardized tests in school. That allows us to look at a larger cohort of patients and really get some good outcomes which are objective and meaningful to parents. So we use data from North Carolina linking their birth defects registry with their educational outcomes, namely looking at how well these kids did on their end of third grade exams in reading and math, how likely were they to be retained in the third grade, and then how likely were they to receive special educational services. And in all those domains, kids who had congenital heart defects were much more likely to have poorer outcomes. All right? They were about 40% likely to fail their reading test, and about 25% of them didn't pass math. All right? Similarly, there were increased risk of being retained in the third grade, and while many were receiving special ed services more than the baseline, some findings suggest that maybe even more need those special ed services, and it's being unrecognized. And a lot of times parents will ask us, is my kid going to have a normal life, or is he going to be able to play football? But they don't ask, can my kid do well in school? It's not something they're thinking about. And so by doing this type of study, we can raise awareness of the importance of neurodevelopmental outcomes and the importance of getting the help these kids need in school so they don't fall further behind than they already are. And we had done a similar study in Georgia using some data as well, looking at just at some of the testing scores. And we've seen it in some other birth defects, including kids with cleft lip and palate. And so we knew that they probably weren't doing as well. We were a little surprised at just how poorly they are doing. So the biggest thing is awareness of the issue. Like as I said, parents aren't thinking about this. School systems aren't thinking about this. Many of these kids that we're seeing these problems in are kids who have actually relatively minor defects or are what we are called repaired and fixed. So even some of those kids though who, we don't consider high risk anymore from a cardiac standpoint, we need to be cognizant of the fact that they're going to have lifelong issues with neurodevelopment, and we just need to pay attention to that and look for needs in these kids where they arise. So for every parent, I think the biggest thing to them is their overall development of their child, and they'll do anything for their kids. And what we would like to see from this study is, though, a few things. So parents, as we mentioned, just their awareness and being able to look for signs in their kids and advocate for the needs of their kids. School systems to look at congenital heart disease, even if it's repaired, as maybe that's should be a trigger that this child should be evaluated for special education services. A lot of these things are just very subtle and they don't show up, and if you're not looking for them, you're not going to be able to give the kids the services they need. So this should just be a trigger to prompt people to look for problems in these kids and give them the services they need. Most parents, they would love for their child to be normal. They would love their child to be all in regular classes, but I think they understand that if there are barriers or problems for their child, that they would like to get the help they need to overcome those barriers and knock them down so their child can succeed. It's a spectrum. Some kids are very high performing and doing great. What we want to do though is help all kids reach that level, and getting the services they need and the help that they need can only do good things in the long term.